It's 6:13 now. With so many hospital beds taken up by COVID patients, it's become more difficult to find room for everyday emergencies.
Erica Zucco spoke with hospitals and freestanding ERs all across the state about what that means for care.
Over the past few weeks, there have been a lot more patients in emergency rooms for University Hospital, Baptist hospitals, Methodist Healthcare System, and Christus Health. On top of that, hospital beds are filling up. And it isn't just impacting San Antonio, it's impacting surrounding areas, including New Braunfels and Livonia. In Livonia, Dr. Jeremy Gabrish, who leads freestanding ER, the emergency clinic, says that means a longer wait for COVID patients who need hospital care.
We are the first line of defense. Patients come to our emergency center when they require oxygen or an ICU bed. We get them stabilized, and then we immediately start working on a transfer. And typically that would take an hour or so. Now we're seeing that it takes days sometimes.
He's seen an overall increase in ER visits, COVID and non-COVID. And so has Dr. Gerardo Ortiz of the Lone Star 24-hour ER in New Braunfels.
We're talking about 130 a day when you were typically seeing less than 20.
He says as hospital beds fill, first responders have even called to ask if his freestanding ER can hold them for a while.
So typically, if you have a patient in a freestanding emergency room that stays over 24 hours, you have to report it to the state. We've had ICU patients that have stayed over 60 hours with us.
The surge they're seeing outside San Antonio echoes the spike they're seeing here in town.
We're usually now seeing about 30 to 40 patients more per day than we had been traditionally.
All three doctors we talked to shared the same request to help ease the surge.
And get vaccinated.
While not all ER visits can be prevented, they say a lot of them can. Erica Zucco, KENS 5 Eyewitness News.